Many young ladies are suffering from hormonal imbalance. Some are caused by infections, PCOS, fibroid, endometriosis, contraceptives, ovarian cysts, and even stress. When we are talking about hormonal imbalance, we are not just talking about one kind of hormone. We are talking about several kinds of hormones. And these hormones controls the woman's reproductive system. Normally, the most significant symptom of hormonal imbalance is irregular menstrual period. Once a woman's menstrual period is irregular, or once a woman misses her period when she's not pregnant, it is a sign that she has hormonal imbalance. If today is your first time of coming across my video, you are highly welcome. Please endeavor to subscribe to my channel and click on the notification bell to get notified each time I make a new post. Why am I making this video? I am making this video to educate every young lady out there that once you notice any symptom of hormonal imbalance, don't be in a hurry to start taking hormonal drugs. The right thing to do first is to run a test that is known as hormonal assay or hormonal profile. This test will guide you to know the exact hormone that is imbalanced and then follow up a proper treatment plan. Some of you have taken hormonal medications, yet it has not balanced. This is because you are taking the wrong medication for the wrong hormone. Like I said earlier, hormone is not just one. There are many kinds of hormone that controls the woman's fertility. Some vital hormones that are responsible for a woman's fertility are follicle stimulating hormone, which is also known as the FSH, luteinizing hormone, which is known as the LH, prolactin, estrogen, and the progesterone. So when your hormone is imbalanced, you may be taking progesterone hormonal drugs. Meanwhile, it is luteinizing hormone that is imbalanced. Or you may be taking hormonal drugs for estrogen, meanwhile it is the progesterone that is imbalanced, and so on and so forth. Now I'm going to teach you on how to run hormonal imbalance tests. Running a hormonal imbalance test have different approaches. If you menstruate every month, like every month you are seeing your period, even though your date is always changing, like you see this month on the 1st, the following month you see on the 20th, and so on, but provided you see your period every month, this instruction is for you. You will go to the laboratory on the 2nd or the 3rd day of your menstrual period. Let's say you started menstruating on Monday. So Monday is your first day, Tuesday is your 2nd day, and Wednesday is your 3rd day. So you will go to the laboratory either Tuesday or Wednesday for them to collect your blood sample. When you are doing hormonal profile, there are 5 hormones they are running for you, except there are other cases of other hormones they may want to add. But the basic ones is usually 5, which are the progesterone, the prolactin, the FSH, the LH, and the estrogen. So the 2nd or 3rd day that you saw your period is when you will go to the laboratory. They will collect your blood sample and run 4 hormones. They will run the prolactin, the estrogen, the FSH, and the LH. After that is done, you will return back to the laboratory on day 21 for them to collect the last hormone, which is the progesterone. How to know your day 21 is for you to start counting from the first day you started menstruating down to 3, 4, 5, 6, 13, 14, 15, 16, 19, 20, 21. That day 21 now is when you will now go back to the laboratory. They will collect your blood sample and do a progesterone test. Reason why you are going on these different days is to monitor your hormone and see how they respond to each other. The progesterone test that you are going on the 21 to run is the hormone that is responsible for ovulation. Going there on the 21 is for them to know the state of your ovulation level, because it's usually 7 days after ovulation that falls on that day 21. If you miss this day 21, just know that the other processes is a waste of time. So you have to be very cautious and take note of this. But please, when you go to the laboratory, whether on your day 2 or your day 21, inform the clinician. Tell the clinician that you're menstruating, today is your day 2, or today is your day 3, are you coming back on day 21? Just interact with your clinician. Now, for those that don't menstruate at all, like you have not seen your period for a couple of months, in your own case, they will collect your blood sample and run all the hormonal tests. You don't have to come back on day 2 because of course you're not menstruating, not to talk of day 21. So just go to the laboratory, pay for the test, they'll get your blood sample and they run the hormonal test for you. But please remember to inform whoever that is attending to you in the laboratory or in the hospital about your health condition. Tell the person you're not menstruating or tell the person you're menstruating. Just relate with your clinician. This test is very important for any woman that wants to conceive because it is a fertility test. Once the result is ready, there will be a proper guideline on what medication you need to take because the imbalance hormone will be indicated in the result. At this point, you're not taking any kind of hormonal drugs. You are now taking medication based on your test results. Once everything is balanced and working well, go back to the laboratory and run a confirmation test. It is very important. Don't just relax. Once a confirmation test shows that yes, everything is okay in your body system, that is the only time you should relax. Thank you for watching and don't forget to subscribe.